in medicine, we have not been even focusing on this. It has to be a better way. We go, again, safety number one. And we love that because we want to educate the world. We treated more than 15,000 patients now. Well, it's a pleasure being here. We've been doing this, Neil and myself, now for, 14 years, and it gets stressful, but it's at the same time, it's a passion of mine since I got involved in this, and truly, it's been so rewarding when in medicine you can help and improve the quality of life of people, and that truly is what has made us continue against the grain in this fascinating field. And those results are really what makes us go. And Roberta, again, is a great experience of somebody, a doctor who witnessed these things. And then for us, again, it's been wonderful. I think I'm going to mention a little with Mel Gibson's dad. It was incredible because one day Neil calls me, hey, Mel Gibson wants to talk to you, do a conference. I'm like, Mel Gibson, wow, can't believe that. So we had this conference call, and Mel Gibson, the doctor from Mayo, Neil, myself, and when he started talking about what Mel Gibson's dad had, he had a little of everything imaginable. And I'm like, well, this bad hips, shoulders, heart failure, kidney problems, you name it. And I'm like, well, there's some rationale. After discussing with the doctor, he said, well, this is a place to go. When he arrived, and I looked at Mr. Gibson, I said, Neil, I don't want Mr. Gibson's dad to pass away here in Panama. We're going to be in trouble. And he looked bad. And so when we treated him, 2 months later, Mel calls us, and you guys have to come to California, and you got to see my dad. And it was an incredible experience how when we show up there, he felt like new person. It was like rejuvenation. And it's really what we're going to be talking today is that at 91, he depleted all his own cells, as Roberta put in that slide. And we just put this young army of cells that wanted to repair. We put him in both hips. He took the wheelchair off and he did a moonwalk to us. That was amazing. And he kept coming every year. And we celebrated his 100th birthday, which, again, that was fascinating. And that's one of the, again, a lot of the stories that we witnessed through the years. So I'm going to talk about a little concept. I think Roberta pushed the point about MSCs, and I'm going to keep emphasizing that. Then I'm going to talk about our center, what makes us different, what makes us unique. And I feel really proud of what we've been able to achieve in Panama, and it's been not easy. Again, we've worked hard into creating a network of doctors, technicians that we feel totally proud that we are world recognized in that. And then talk about arthritis and sports injury, which is a big thing now. And then I'm going to finish with what Roberta was talking, which is the key, inflammation. And we're going to keep talking about inflammation and how that affects everything that happens in our body. So I was practicing, my training is internal medicine. I was doing primary care in San Antonio, Texas, where I practiced for 11 and a half years. And I was dealing with chronic diseases all the time. Patient with hypertension, diabetes, heart disease, cholesterol. And it was because we're trained to be reactive. That's really the way we are taught. It's more pills, this, that, and prevention was not even discussed. It was like, well, exercise better and eat better. And in that 15-minute consult, I knew we were failing. And then we did the typical lab work, and the labs looked relatively okay. Well, Mr. Smith, your labs look great. And he's like, well, I feel horrible. And I said, we're wrong. We're trained in the wrong way. And it was the same complaint. I'm tired. I have no energy. I can't sleep. Sex life, everything hurts. And I said, it has to be a better way to addressing all these things. And that's why I did a switch and looked into preventative. Some call it anti-aging. It's not like we're going to stop the process. It's improving the quality of life. And you start looking at hormones, you start looking at vitamins, you start looking at nutrition. And it really changed my life as a doctor when I could really help and improve the quality of life of my patients. So that's when I moved back to Panama, that's where I started, and it was really rewarding. And then, incredibly, that's when I met Neil with Rodolfo Fernandez here, which is our other partner. And it was 17 years ago, and he blew me away of what the knowledge he had. And what surprised us more was what we as doctors knew very little at all. But something in me told me this is something worth pursuing. And we saw what he had, and we continued that road of filing the legal framework in Panama, which was really key. And we knew people in high places that allowed us to be heard. And that's really what needs to be happen here in the US. And we had to go through a whole process. Our lab is in a technopark in Panama, which is state of the art, but we had to go through all these credentialing, which is great. And we helped regulations, and that's the reason why, again, we've done it in Panama, and that's the reason why we've grown there. It's not been easy, again, but it's truly rewarding when we can help people. And again, we put Panama really in the map of all this. So again, regenerative medicine is a big field now that we're learning more and more about this ability for our body to help heal itself. And we have in our body, as we talked, as Roberta mentioned, we all have these MSCs, so these cells that help with that repair process, but unfortunately, you keep withdrawing them, and then it makes it hard to help heal, or when a disease hits you, it makes it hard for us to recover. So this is truly what we're trying to do, is help that process by controlling, go back to inflammation. So I like this cartoon because I think that basically resumes everything that we do. It's all about helping repair our body. So MSCs, again, basically the term stem cells is kind of a sexy name, but that's not what they do. They're truly medicinal. They're truly a little factory that releases all these molecules that have to do with, again, controlling inflammation, helping or quieting down the immune system. That's why we've had a lot of success with autoimmune diseases. I was just talking to a doctor here that referred a patient with MS, which is an autoimmune disease. And she got treated, and she's been symptom-free for 10 years now, without the need of any other biologic medication. We have a great friend now that I consider a patient, Adam, with MS, and he was a very, he was compromised significantly with his MS. And we've been treating him for a while. Some patients require, because it's not a cure, and we're clear with that with patients. This is a therapy that in some instances you may need to come back every 2 years, depending on how the disease progresses or not. And he's had it for several times now. And gratefully, and for us, again, we feel really grateful and proud that how he's responded, like many other cases we have. So these cells, as were discussed, they're throughout our body, and when we have injuries, they help us repair, but they get depleted through the years. Again, control inflammation, modulate the immune system, and help repair what can be repaired. Again, there are things in our body, or there are conditions that can be reversible, and some don't. So we are really straightforward when we get applications on where the stage of the disease and what makes rationale or not. And we're really strict in that criteria. I think Roberta talked about this, about the difference. We're not embryonic. We're not getting fetuses, killing moms, killing babies. These cells are a product that, incredibly enough, is thrown away, the cord. It's not the blood of the cord. It's the cord itself where these cells reside, and they're the ones that have that ability to do all the processes that we've been talking about. And the key thing is that they do not exert tissue rejection like adult tissue. So that's why you can use these cells that come from donors that have been obviously highly screened, and I'll talk a little about that, and really without any type of adverse reaction or side effect. These are all the other clinical relevant areas that I think Roberta also mentioned. Bone marrow fat, but we talked about that you want a younger product, more robust because of what they're secreting. These are, again, we're not in a bubble in Panama. There are studies, when we started this 17 years ago, there were barely any studies done. And a lot has happened, a lot has changed through the years of other groups looking at safety, which again, number one priority. When we got involved, I wanted to make sure as a doctor that I was recommending to my patient something that's safe. And obviously, that was still a priority, and these are different studies that have been looking at safety of these cells, and sure enough, it's proven not only what we've been doing, but other centers. This is another study that was looking at safety data, and also the same thing concluded that basically it was a safe product. So now, I'm going to focus on Panama, or Stem Cell Institute in Panama, which is really the key of everything that happens. Again, we started this in humble beginnings with one person in the lab, Rodolfo, myself, and Neil, and that was it. And we started growing, and I feel really proud of what we've been able to achieve in Panama. We have more than 100 highly trained, from technicians to physicians, that have really high standards of quality. And for me, that's really what makes us really proud to see them grow in this field. And again, people come all over the world to see what we have. When patients started coming initially, they were coming totally against medical advice. That has changed dramatically. Now doctors that are, this younger generation of doctors are reading more, understanding more, and they come, and we're really transparent. We love having doctors come down, see what we have, go to the lab, and they get highly impressed. This is the state of the art. They say, wow, I'm so amazed at what you guys hear. This patient from Australia came down, and they brought their own doctor because they didn't trust what was going on here. So the doctor came, I give him a talk of what we do, all this, and the doctor looked at me. I said, well, you know what? I want to get treated. So he got treated also. And so it's amazing, and we love that because we want to educate the world. We collaborate with other centers, other places in the world are doing it. Panama is not alone. Japan, Korea, Israel, etc. And we love that union with all these other places where we learn each other about what's going on. So we have a research laboratory, a state-of-the-art, where we have 15 dedicated researchers that look at everything we do, all the processes we do. Again, this, as I mentioned, is an evolving field. We learn every day a little more. And we'll go and talk about why our cells, or what makes us different. And it's something because we have active researchers, lab, that look at this every day. And then the cell production that we have more than 85 now technicians. We treated more than 15,000 patients now. And the key thing is no significant serious adverse events. So, without going in specifics, again, it's state-of-the-art facility. We do GMP. We go, again, safety number one. So we want to make sure when that cell goes out that it goes through a really, really extensive process of evaluation to make sure it's free of infectious diseases, that it's optimal to use, and it has the potency and the quality, and I'm going to talk a little about that. So what makes us different? We have a GMP syringe prep room where basically the cells are prepared for the treatment of that day and that week, and that gives us that high standard of care and quality control, which is really, really key for us. We had to invest a lot, but at the end, it pays when we have a peace of mind that we have a safe product and following all the standards. And I'm going to go a lot into this, but again, we get the cores, they get processed, these cells divide in these plates, and it's incredible. When you see it in a microscope, you see these cells dividing. So it's really fascinating technology that it's just amazing. And they have to go, again, making sure they're free of infectious diseases, endotoxins, and making sure they're truly MSCs, because we've heard other groups that, yeah, we have 1 billion cells. I said, but what type of cells? Are they probably, most of them are dead, et cetera. So the key is you want to make sure, again, they're potent and they're alive. And we go through all that process. I can't emphasize how important that is in what we do. So this is our beautiful city of Panama. I don't know how many have been here. I know a lot of my friends have been for other reasons, partying, et cetera, but but it's a beautiful country. We have both oceans an hour and a half away, and our center is a really state-of-the-art place in the middle, again, surrounded by the ocean. So we always, this beautiful skyline of Panama. Some people, when they go to Panama, they think we're still in horses and all these things there, but it's a modern city. It's like a little Miami. And so we're really proud. This is the entrance of the clinic. Again, it's a very simplistic process. Basically, it's typically IV infusions and the protocols that we use, again, when we apply them in joints or backs or spine, et cetera. But it's really seamless and totally ambulatory. The patients go back to their hotel, which is next to the clinic, and the recovery is really minimal. So a lot of people do a little tourist in Panama. They go restaurants. So it's very simple. This is our great staff of nurses. They made sure, they told me, you have to show us that picture. So here they are, beautiful, great. Again, that's when we talk to patients, they say how they treated us. I think that the key is that experience of from when they pick you up at the airport, the VIP, to taking you to the hotel, and to getting the staff from they go to see our front desk, to the nursing staff, to the doctors. And that's something that I can't overemphasize, that makes the experience for somebody to come to another country for a treatment. But it's the ease, how they feel when they leave or while they're treating that makes a big difference. So it goes, I'm not going to go in detail this, but it's an active process that we've standardized it through the years, where we get a lot of applications, hundreds of applications, and we are really strict. And where there's indications and contraindications for treatments, and the more we say no, the more the patients want to come. But we are, again, have to have basis of where we have experience, when there's studies, and we've published. That's another big thing that many groups have not. So we not only have published clinical studies on MS, autism, and other autoimmune diseases, but we collect data also. So that's why we have information on the patients that have come and why this is worth continuing to treat, because there's efficacy in what we do. And again, we're really strict in where there's rationale, and they go through a whole process of reviewing the application. We have a group of doctors that review, including myself, review every case and ask for more medical information. So it's very, very, which the way it has to be. And then once we get that process, then we have patient coordinators. Cindy Cunningham is here. We're really good into helping them in that experience of coming down, very seamless. So that's something very important. So what makes us different? I know Neil is going to talk about the golden cells, but that's truly what differentiates us from other places. Again, we go that extra mile of looking at what makes these cells do what they do. And we were looking many years ago now, some patients were having, all of them were doing better, but some were remarkable, the result we were looking. So we went back, because we store all the lots, so we can go back and what was happening in these patients that were responding amazingly. And without doing a whole lecture on that, we found that some cords, some of these cells, were producing more of these molecules that we talked about in a higher rate that made them more effective. And that is something that we have been able now to identify. Just to give you an idea, out of 10 cords that we get, 7 don't follow approximately that criteria, that strict criteria of robustness, and those are what we label golden cells. I think that's been a key thing, and that's why we keep thriving into even improving outcomes by doing these things. So that obviously has really significantly boosted the results that we've seen through the years. Again, we are a GMP facility. We follow all the criteria. It's something really, again, we can't overemphasize the standards that you have to keep to deal with the cells. And all the products are evaluated by third-party laboratories to make sure they're free of infectious diseases. And the mom is screened, the cord of the blood is screened before we use them. So it's, again, safety, number one. I mentioned that already. We collaborate. Again, we're not in a bubble here. We collaborate. These are centers that we've collaborated with scientists that works in this facility. So we're always looking, communicating with what's happening all over the world. And that's really a key thing to allow this therapy to be more, it's kind of a worldwide. It's an unfortunate thing with the U.S. I think there's a light at the end of the tunnel that at least, again, what I tell people is this should be an option, that a patient should decide, hey, I want to consider this, and talking to a doctor. I think we're getting there, and hopefully it will happen. So this is some data. These are some of the conditions that we treat more or less. Guess what is the common denominator on all this? Inflammation. Most of it, or everything bad that happens in our body. So these cells, again, are potently anti-inflammatory. That's why these conditions basically respond to them. I'm, again, overemphasizing the amount of treatments that we've infused these cells. It takes approximately like 40 minutes. And again, the patient leaves, we check vital signs and all that. So it's really seamless. And again, no serious effects. Mainly, some patients describe pain or inflammation in the site of injection, a little headache, a little fatigue, a little chill, because the cells are releasing all these factors that we talked about. So it's really a temporary thing that happens and goes away the next day. So talking a little about arthritis, which is a big group of patients that we deal with, and it's a disabling condition. We're living longer, but unfortunately our joints sometimes don't want to follow that accord, and we keep doing stuff like playing basketball, which we still are doing, and we're going to keep doing. Anyway, we're living longer, but our joints sometimes don't want to follow it, and basically the options are real limited, and what they can do for a bad knee or a bad shoulder. It's pain pills, put steroids, therapy, and that's that. So I always felt this is a no-brainer. You put these cells that want to repair it, it's going to help. And sure enough, we've seen some remarkable results. I'm a case. I blew my knee playing basketball when I was 16 years old, and I had arthritis 30 years later, hurting all the time. So I got injected in my knee, and a month later, I woke up, and I'm like, I'm not hurting anymore. I'm like, well, guess what I did? I went to the basketball court the next day. And I'm still doing it. And the interesting stuff is I had an MRI 10 years later, and the cartilage grew. The orthopedic doctor was like, I can't believe it. I said, well, I told you. And so this is becoming an option, obviously, that doesn't involve anything aggressive, in a natural way to help those joints. And it's been pretty amazing. These are other studies that have been looking at efficacy and safety and has proven the same thing that we've looked at. So we did our own data. We do our own data. As I mentioned, this is a questionnaire of quality of life that we looked at a group of patients that we treated for several years. And the blue line is improvement. So they got improvement in physical limitation, in pain, and energy. So those are things that we have found that even though they came for pain in the joint, arthritis, the application of the cells IV, intravenously, was helping them in how they felt overall. And that's what we're seeing, and that's what I'm going to talk about aging. Not only relieving the joint or the joints that were affected, but the overall health. This is just proven that the improvement persisted over a period of years. So pretty amazing. Again, some patients, depending on the degree, again, if you have a joint totally bone and bone with nothing there, it's difficult to regenerate something that's way past. Sooner you can get them, the more likely of reversibility. And some come back later to get a boost, and that's something they felt. This is a quick report. This is a lady, 61-year-old, bad knees, bad shoulders, skiing accident, and this is just her past medical history. Her knee was a mess. Her Right shoulder was a mess, arthritis and multiple inflammatory components. We treated her with IV. We injected her in knees and shoulders. And it was amazing in 2 weeks how she felt both knees. I think the most important part is she went to party in high heels. And I think that was for her the key of what she wanted to get away from it. So, and the shoulder also improved. So this is something that we see time and time again, and it's pretty remarkable. Okay, I'm going to talk about a topic that I love because I'm a sports fanatic, and I always said that athletes would benefit from this greatly. And we were lucky enough that some agents started looking into this, and then they started referring these players, and primarily NFL, which again, as you well know, they're pounded all the time. And you look and talk to these kids, because they're kids, 25, 24, and they're messed up. They have injuries, and you name it, and the options were really limited. This is a player that played for the Cowboys and then the Dolphins. And basically, he was warning, do not follow accordance of what the physicians of the teams want. They just want you put you back in the field by putting steroids, taking pain pills. And so the options for them were real limited. They just wanted the player to go back. So these guys, you know, and good for them, were starting to read and say, what can I do? And the first one who came was a fullback, graduated from Harvard, and he said, what can I do to help my body recover being a fullback? And he did his own research, and he said, well, I think stem cells is the answer for me. And then he said, where can I go? And he found us on his own. When he arrived, I knew who he was, and he told me the reason why he came. And I'm like, good for you. And he kept coming every year now for 6 years. And it's amazing. He's been a Pro Bowler, all pro, every single year. And he kept telling the other players of his team and they're like, nah, we're getting some stuff in the U.S., et cetera. And he kept saying, it's not the same. But they kept looking at him and said, you look amazing. So they started coming, and then I love these kids and watching them, how they recover, how we've treated them, some with pinpoint injuries all over, and some just come for the IV because they feel it's the recovery part of it from the pounding they get day to day. And it's been so rewarding, and they've been talking now to other teams. But again, I feel like, again, they're my boys, and now we're in the Super Bowl, and I'll be there. That's a great thing. So what injuries? Again, they are a mess. So we've had hips, ankle, shoulders, turf toes, sprains, partial tears. And the case I'm going to present was, again, these are the players that we've been treating. The amount that has grown significantly. And so this is a defensive back who had a grade 3 thickness tear on a bicep femoris here in the leg. Typically, that injury takes 3 months to heal. So he wanted to play because this happened in training camp. And so he came down, we gave him the IV, and then we applied the cells directly to the area where the tear was. And he called me up in 2 weeks and said, I feel incredible. I said, but take it easy, don't go back. So again, he went to full practice a week later and full activity for the first game of the season, and he became an All-Pro. So that was so gratifying. That's what we're seeing is how the cells, because of what they secrete, help in that healing process. It accelerates the healing, and that's what we're seeing a lot in these athletes. George Kittle is, I feel like a son now, and he just loves us and how he's been able to recover.
Hey guys, George Kittle here. I just want to give my thoughts about stem cells and how it's kind of helped me in my career and my journey in NFL. I started doing stem cells 3 or 4 years ago. Started going to Panama 2 years ago. I've been a huge fan of it. Whether it's the trip down, the facilities, the treatment you get down there has been nothing but 5 stars. It's been fantastic. But really, the experience I have with stem cells, one of the biggest things I notice about after I use stem cells is the recovery time. I feel like I can bounce back just a little bit faster. I don't feel as sore the next day after games or practices. My body was just consistently bouncing back at a higher rate, and I felt like I was outlasting the competition and other guys, even whether they're on my team or not on my team. And I would go into every single week with the confidence in my body to be healthy, and that allowed me to play at a higher level. And so that's one of my biggest things with stem cells. I've had issues, whether it was I had some Achilles things going on that I was able to treat and saw almost an immediate recovery on that, immediate pain relief on that, and I was allowed to play at a higher level. So I've had nothing but success with stem cells. My dad started going. He's had his second treatment now. He sees incredible results. He's 64 years old, rides bikes, about to do a half Ironman. He's running 5 miles. He hasn't done that in 30 years. So the benefits, he feels them as well. So I'm a huge fan. I'm a huge supporter of it, and I'm looking forward to going back again. Thanks, guys. Thanks, Jorge. You're the man.
I'm Jorge, by the way. So, so anyway, that his dad came, and it was amazing. He's a big athlete who was in problem, and he's benefited also. I'm going to finish with the last part of it that I briefly wanted to talk. I think it's a key thing of aging and inflammation. We go back to that issue. There's studies now to document that everything that happens with the aging process is because of inflammation that affects every part of our body. That's why hormones decline. That's why cognitive functions decline. That's why we lose muscle mass and we lose bone density. So all these little things add up. And in some people, because of genetic reason, the curve can be very dramatic. And some it can stabilize, but overall it's going to happen. Even though, again, in medicine, we have not been even focusing on this. We simply keep treating them, giving more pills. But this becomes interesting, and for me, that's something that I have seen now in the patients that have been coming as a treatment for, you're investing in your health once a year or every 2 years, and to control that inflammatory process and hopefully help that curve to kind of straighten out and go all the way down. And this was a study done University of Miami on frailty, which again, these are patients who were more compromised, and they found, this was with bone marrow, so these were donated bone marrow. Even with that product, they found statistically significant benefits in different quality of life issues, cognitive, how they felt overall. Interestingly enough, on erectile dysfunction, they found benefits on that, so that was pretty amazing. So anyway, that was an interesting study. And we've been conducting our own, and the patients have been following now. And the things that we look at now is we go back to objective markers. So we've been looking at the hormones in patients that we've been treating now for a while and see how by themselves, without the need of hormonal therapy, how they get better. Inflammatory markers, they're blood markers that we can check. So these are objective things. And the other two that we talked about, how important is your bones. And so we have a body, a DEXA scan, and then we have body mass index, so we can look at muscle, fat, and water content in the body. So it's really interesting. And again, the extreme example is somebody like Mel Gibson's dad, how frail he was, and all these markers were really low, and how he perked up, and we've seen it multiple times. So with that, I'm going to conclude. Thank you very much.